The year was 1943. The smell of antiseptic and blood filled the overcrowded field hospital somewhere in the North African desert. Outside, the temperature soared past 100 degrees. Inside, young men lay dying, not from their wounds, but from what came after. The gangrene was spreading faster than the surgeons could amputate. Lieutenant Elizabeth Mason had been a nurse for less than 2 years, but she had already seen more suffering than most people witness in a lifetime. Fresh out of training in Boston, she volunteered for overseas duty against her family's wishes. Now, stationed at a forward surgical unit supporting the Allied advance through Tunisia, she faced a crisis that would test everything she thought she knew about medicine. The problem was simple, yet terrifying. Wounded soldiers arrived at the field hospital with shrapnel wounds, bullet injuries, and broken bones. The surgeons did their best, working 18-hour shifts under impossible conditions. But in the desert heat, with limited water, inadequate supplies, and swarms of flies everywhere, infections spread like wildfire. And once gangrene took hold, there was only one solution: amputation. Sometimes even that wasn't enough. On this particular morning, Elizabeth stood in the recovery tent, checking on Private James Morrison. He was 19 years old, from a small farm in Iowa. 3 days earlier, shrapnel had torn through his left leg during an artillery barrage. The surgeon had cleaned the wound, removed what metal he could find, and stitched it up. Everything should have been fine. But it wasn't. The smell hit Elizabeth before she even reached his cot. That sickly sweet odor of decaying flesh that every nurse learned to dread. She pulled back the bandage, and her heart sank. The wound had turned black at the edges, the tissue dying as the infection consumed healthy flesh. Gangrene. Again. Private Morrison looked up at her with frightened eyes. He knew what that smell meant. He had seen them take 3 other men from this tent to the surgical station. 2 came back with stumps where their limbs had been. 1 never came back at all. Elizabeth placed a gentle hand on his shoulder. She told him the doctor would be by soon. She told him they would do everything they could. But they both knew what everything meant: the saw, the screaming, the permanent loss, if he was lucky enough to survive. As she walked away, Elizabeth felt the weight of helplessness crushing down on her. She had joined the Army Nurse Corps to save lives, to make a difference. Instead, she watched young men lose their limbs or pass away, one after another, while she could do nothing but change bandages and offer false comfort. The chief surgeon, Major William Bradford, was a gruff man in his 50s who had served in the First World War. He ran the surgical unit with military precision and little patience for what he called romantic notions. When Elizabeth approached him about Private Morrison, he barely looked up from the instrument he was sterilizing. The major's response was blunt. The leg would have to come off, today, if possible. The infection was spreading too fast. Wait another day, and it might reach the torso, and then nothing could save the boy. He told Elizabeth to prep the patient and have him ready within the hour. Elizabeth felt sick to her stomach, but she nodded and turned to leave. As she did, she heard 2 other surgeons talking near the supply tent. They were discussing a curious observation. One of them had noticed that wounds left temporarily untended, wounds exposed to flies before bandaging, sometimes healed better than those that received immediate attention. It made no sense medically, but both men had seen cases where fly-blown wounds somehow resisted gangrene. The conversation lodged in Elizabeth's mind like a splinter. That night, unable to sleep in the suffocating heat of her tent, she thought about what she had heard. Flies and healing. It seemed absurd, disgusting even, but she couldn't stop thinking about it. Elizabeth had grown up on stories about her grandmother, who had been a nurse during the American Civil War. She remembered one story in particular, though it had seemed like just a grotesque tale at the time. Her grandmother had spoken about Confederate surgeons who sometimes left maggots in wounds deliberately, claiming it helped prevent infection. Elizabeth had dismissed it as primitive medicine from a barbaric age, but now, with that conversation echoing in her mind, she wondered. The next morning, Elizabeth did something that could have ended her career. She went to the hospital's small medical library, really just a tent with a few dozen textbooks and journals. She searched through every volume, looking for any mention of maggots and wound care. Most books dismissed the practice as superstition or desperation tactics from less enlightened times. But then she found it. A medical journal from 1931 contained an article by Dr. William Baer, an orthopedic surgeon from Johns Hopkins. He had deliberately used sterile maggots to treat chronic bone infections. The results were remarkable. The maggots consumed only dead and infected tissue, leaving healthy flesh untouched. They secreted substances that actually fought bacteria. Patients who had suffered for months healed within weeks. Elizabeth read the article 3 times. Her hands trembled as she turned the pages. This wasn't primitive superstition. This was documented medical research from one of the most respected hospitals in America. Yet here, in 1943, surrounded by the most advanced military medical system in history, they were still sawing off limbs because they had no better option. She found Major Bradford in the surgical tent, scrubbing up for another amputation. When she tried to explain what she had found, he cut her off immediately. He told her that battlefield medicine had no room for experimental theories. They used proven methods, surgical debridement, amputation when necessary, and prayer for the rest. He ordered her to return to her duties and stop wasting his time with disgusting ideas. Elizabeth wanted to argue, to make him listen, but she knew it was pointless. Major Bradford was a good surgeon and a decent man, but he was also rigid, bound by protocol and traditional thinking. He would never approve what she was considering. That afternoon, Private Morrison's condition worsened. The black tissue had spread further up his leg. Major Bradford examined him and scheduled the amputation for the following morning. The young soldier cried quietly as the major walked away. He wasn't crying from pain, but from the knowledge that he would never walk normally again, never run across his father's fields, never dance at his own wedding. Elizabeth sat beside Morrison's cot long after her shift ended. She held his hand and let him talk about home, about the girl he planned to marry when the war ended, about the future he had imagined, before shrapnel tore through his leg. As she listened, she made a decision that would haunt her for the rest of her life, regardless of the outcome. She waited until after midnight, when the night staff were occupied with new casualties from a skirmish near the front. She gathered what she needed: clean bandages, antiseptic, scissors, and a small glass jar. Then she stepped out into the desert night. Finding the right flies took less time than she expected. The desert was full of them. She collected several dozen in her jar, making sure they were the right type. Not just any fly would work. She needed blowflies, the kind that laid eggs in decaying matter. She had to trust that nature would do what nature had done for millions of years. Back in the tent, she carefully removed the bandages from Morrison's wound. The stench made her eyes water. Working by the dim light of a shielded lantern, she cleaned around the wound as best she could without disturbing the dead tissue too much. Then, her stomach churning with doubt and fear, she allowed several flies to land on the exposed flesh. They laid their eggs almost immediately, tiny white clusters in the dead, black tissue. She bandaged the wound loosely, allowing airflow but keeping the flies away from healthy tissue. Then she sat back and wondered if she had just ended her career, or worse, if she had just condemned a young man to a horrible end. Elizabeth barely slept that night. She kept seeing Morrison's trusting face, kept thinking about what would happen if she was wrong. By morning, she was convinced she had made a terrible mistake. She prepared herself to face the consequences, to confess what she had done before the scheduled amputation. But when she checked on Morrison just after dawn, something unexpected had happened. The wound didn't smell worse. If anything, The sickly sweet odor of gangrene had diminished slightly. She unwrapped the bandage carefully, not sure what she would find. What she saw made her catch her breath. Tiny white maggots, no bigger than grains of rice, were moving through the black tissue. It was revolting to watch, but as she looked closer, she noticed something remarkable. The maggots were only in the dead, infected flesh. They ignored the pink, healthy tissue at the edges of the wound, and the wound itself looked different. The angry red inflammation had reduced. The black edges seemed less extensive. She quickly rebandaged the wound before anyone could see. Her heart was racing. It might be working. It might actually be working. But it was still too early to know for certain, and in a few hours, Major Bradford would arrive to take Morrison to surgery. When the Major made his rounds that morning, Elizabeth did something that would require an explanation she couldn't give. She told him that Morrison's condition had improved overnight. She suggested they postpone the amputation for 24 hours to see if the improvement continued. Major Bradford was skeptical, but when he examined the wound, he had to admit that it did look marginally better. The infection didn't seem to have spread further. Grudgingly, he agreed to wait one more day, but no longer. Over the next 24 hours, Elizabeth checked on Morrison every few hours. Each time, the wound looked better. The maggots were doing their work, consuming the dead tissue with methodical efficiency. The smell of gangrene continued to fade. The inflammation decreased further. By the next morning, when Major Bradford came to take Morrison to surgery, the change was undeniable. The Major stood by the cot, staring at the wound with a mixture of confusion and disbelief. He asked Elizabeth what she had done differently. She hesitated, then told him the truth. She explained about the article she had read, about the deliberate use of medicinal maggots, about what she had done in desperation to save Morrison's leg. The silence that followed seemed to last forever. Major Bradford's face went through several shades of red. He told Elizabeth that what she had done was reckless, insubordinate, and went against every protocol of military medicine. He should have her court-martialed. He should have her sent back to the States in disgrace. But then he looked at Morrison's leg again, at the healing tissue, at the young man who still had both his legs, and Major Bradford, for all his rigidity, was first and foremost a doctor. He told Elizabeth that her methods were revolting. He told her that this was probably the most disgusting thing he had ever seen in medicine. And then he told her to do it again on 3 other patients who were scheduled for amputation that day. Word spread through the medical staff like wildfire. The nurse who was using maggots to treat gangrene, some were horrified, many were disgusted. But everyone was curious, especially as Morrison continued to improve. Within a week, his wound had healed enough that infection was no longer a threat. Within 2 weeks, he was walking with crutches. Within a month, he returned to limited duty. He kept both his legs. The 3 other patients Elizabeth treated showed similar results. Not all wounds responded equally well, and the method didn't work on every type of infection. But for gas gangrene and certain bacterial infections, the maggots proved remarkably effective. They consumed dead tissue faster and more selectively than any surgeons could cut it away. They produced substances that actively fought infection, and they transformed what should have been amputations into manageable wounds. Major Bradford, despite his initial revulsion, became an unlikely advocate. He contacted Medical Command and explained what was happening at their field hospital. He sent detailed reports and photographs. He argued that in the absence of sufficient antibiotics and sulfa drugs, they needed to explore every possible treatment option. The response from Command was mixed. Some senior medical officers were intrigued. Others were appalled at what they considered a return to Dark Age medicine. But as casualties mounted and antibiotic supplies remained critically short, desperation drove decision-making. Other field hospitals were authorized to experiment with the technique. Elizabeth found herself in an unexpected position. She was asked to train other nurses in the proper procedure, how to select the right flies, how to ensure the maggots stayed in the wound and didn't spread to healthy tissue, how to monitor the treatment and know when to remove the maggots before they matured, how to deal with the psychological impact on patients who initially recoiled in horror at having insects deliberately placed in their wounds. That last part proved crucial. Soldiers had to be convinced that this revolting treatment would save their limbs. Elizabeth developed a careful way of explaining it. She would sit with patients and tell them about Morrison. She would explain how maggots in nature cleaned away dead animals, preventing disease. She would emphasize that this wasn't some witch doctor cure, but based on real medical research from respected institutions. Most importantly, she would give them a choice: the saw or the maggots. Most chose the maggots. The technique had limitations. It only worked on certain types of wounds and infections. Timing was critical. The maggots had to be introduced after initial debridement, but before infection spread too far. The process was labor-intensive, requiring constant monitoring, and there was always the risk of contamination if the wrong type of fly was used. But over the following months, Elizabeth and the other nurses who adopted her methods saved dozens of limbs that would otherwise have been amputated. Young men who should have spent the rest of their lives as amputees went home whole. Soldiers who would have passed away from spreading infection survived to see their families again. News of the technique eventually reached medical journals back home. Articles appeared describing the use of medicinal maggots in battlefield hospitals. Some doctors praised it as an innovative solution to a critical problem. Others condemned it as a desperate measure that would be abandoned as soon as proper antibiotics became available. Both sides were right. As the war progressed and antibiotic production increased, the need for maggot therapy decreased. Penicillin and the new sulfa drugs proved even more effective, with none of the psychological challenges or logistical difficulties. By the time the war ended in 1945, maggot therapy had largely disappeared from military medicine again. Elizabeth Mason returned home in late 1945. She had been promoted to captain and received a commendation for her innovative medical work under combat conditions. But she rarely spoke about the maggots. When she did, she was careful to emphasize that she hadn't invented the technique. She had simply remembered an old method and had the courage, or perhaps the desperation, to try it when modern medicine had nothing else to offer. She returned to nursing at Boston General Hospital, where she worked for the next 30 years. She never forgot Private Morrison or the dozens of other young men whose limbs she had saved with a solution that everyone initially thought was impossible. Some of them wrote to her over the years, sending photos of their children, their weddings, their lives they lived on 2 legs instead of 1. The story of Elizabeth Mason and her use of medicinal maggots became a footnote in the medical history of World War II. It was overshadowed by bigger stories: the development of antibiotics, the advances in surgical techniques, the discovery of blood plasma preservation. But for the men who kept their limbs, it was the most important medical advancement of the war. In the decades that followed, medicinal maggots largely disappeared from Western medicine. The technique was considered primitive, a relic of desperate times. Medical schools didn't teach it, hospitals didn't use it. The flies and their larvae were replaced by antibiotics and antiseptics that smelled better and didn't revolt patients. But medicine has a way of coming full circle. By the 1990s, doctors began encountering a new problem: antibiotic-resistant bacteria, infections that didn't respond to even the strongest drugs, wounds that wouldn't heal, especially in diabetic patients and the elderly. And once again, researchers began looking at old solutions to new problems. Medical maggots made a comeback. Research confirmed what Elizabeth Mason and the Civil War surgeons had observed. The larvae produced powerful antimicrobial substances. They consumed only dead tissue, promoting natural healing. They were effective against bacteria that resisted antibiotics. Major medical centers began using them again, this time with careful protocols and FDA approval. Today, medicinal maggot therapy is an accepted treatment option for certain chronic wounds. The maggots are raised in sterile conditions, ensuring they carry no harmful bacteria. They come in special medical containers that keep them confined to the treatment area. Thousands of patients have benefited from what once seemed like an impossible, disgusting solution. Elizabeth Mason passed away in 1989 at the age of 70. Her obituary in the Boston Globe mentioned her military service and her decades of nursing work. It included a brief paragraph about her unconventional treatment methods during the war, though it spared readers the details. But among military medical historians, her name carries more weight. She represents something important about medicine during wartime: the courage to try unconventional solutions when conventional methods fail, the willingness to look beyond disgust and prejudice to see what actually works, the determination to save lives even when it means challenging authority and risking one's career. Her story also illustrates a pattern that repeats throughout medical history. Ancient treatments dismissed as superstition sometimes contain genuine therapeutic value. Folk remedies that seem absurd often have rational biological explanations, and sometimes the most advanced solution is to remember what worked before modern medicine forgot it. The soldiers Elizabeth treated rarely spoke about the maggots. When they told their war stories to children and grandchildren, they mentioned the battles, the fear, the camaraderie, the long journey home. But Private Morrison, the Iowa farm boy who inspired Elizabeth's desperate experiment, told the whole story to his grandson in 1982. He was 80 years old by then, sitting on the porch of the farmhouse where he had grown up. His grandson, a pre-med student, had asked about the scar on his grandfather's leg. Morrison pulled up his pant leg to show the white lines that traced across his calf, the permanent reminder of shrapnel and infection and healing. He told his grandson about the field hospital in Tunisia, about the smell of gangrene and the sound of the surgical saw, about the young nurse who came to him in the night with an impossible idea. He described his revulsion when she first explained what she wanted to do. He remembered the feel of the maggots moving in his wound, a sensation that still made him shudder decades later. But then he stood up, putting his full weight on both legs. He walked across the porch and back, steady and strong despite his age. He told his grandson that every step he had ever taken since 1943 was a gift from that nurse and her revolting maggots. Every dance at every family wedding, every walk through the cornfields of his farm, every time he had carried one of his children or held one of his grandchildren, all made possible by something that seemed impossible at the time. His grandson went on to become a surgeon. He kept the story of his grandfather's treatment in mind throughout his career. Decades later, when he encountered his first case of antibiotic-resistant infection in a diabetic patient with a non-healing wound, he remembered. He ordered medicinal maggot therapy. The patient kept her foot. This is how medical knowledge persists and evolves. Through written articles and textbooks, yes, but also through stories passed from one generation to the next, through the memories of patients who experienced remarkable recoveries, through nurses and doctors willing to look past their own revulsion to see what actually helps. Elizabeth Mason never claimed to be a hero. When interviewed for a local newspaper in 1975, she said she had simply done what any nurse would do, tried to help her patients with whatever tools were available. She insisted that the real heroes were the soldiers who endured the treatment without complaint, who trusted her enough to let her try something that seemed insane. But the soldiers who kept their limbs had a different perspective. To them, she was the nurse who refused to accept that amputation was the only option, who read old medical journals by lamplight in a desert tent, who had the courage to challenge a major and to try something everyone else thought was disgusting and impossible, who saved not just their limbs, but their futures. The North African campaign where Elizabeth Mason developed her technique lasted from 1940 to 1943. It was a brutal theater of war, fought in extreme heat, dust storms, and supply shortages. Medical units operated under constant pressure, dealing with casualties from combat, accidents, disease, and the harsh environment. Innovation was born from necessity, and desperate conditions demanded desperate solutions. Elizabeth's approach spread to other theaters of the war. Nurses in the Pacific Islands, facing similar challenges with tropical infections and limited supplies, began using medicinal maggots. Reports came back of similar success rates. Field hospitals in Italy adopted the technique for certain cases. Even some civilian hospitals in areas with antibiotic shortages experimented with the method. The military medical establishment remained divided. Progressive doctors saw it as a valuable tool in specific circumstances. Conservative physicians viewed it as a temporary measure, acceptable only until proper medicine could be implemented. The debate played out in medical journals, at conferences, and in hospital corridors. What everyone agreed on was this: the technique worked. Not perfectly, not in every case, but often enough to matter. In a war where every whole soldier who survived meant one more person to rebuild the world afterward, that was significant. The psychological impact on the medical staff was substantial. Nurses had to overcome their own revulsion to administer the treatment. They had to become experts in insect identification, learning to distinguish beneficial blowflies from potentially harmful species. They had to develop techniques for containment and removal, and they had to deal with the reactions of other medical personnel, ranging from fascination to disgust. Elizabeth trained dozens of nurses in the technique. She developed written protocols, drew diagrams, and answered countless questions. Some nurses took to it immediately, understanding the biological logic. Others struggled with their initial reactions, but persisted when they saw the results. A few refused entirely, unable to overcome their revulsion, despite the evidence. Patient reactions were equally varied. Some soldiers accepted the treatment readily, grateful for any alternative to amputation. Others had to be convinced, talked through their fears and disgust. A few refused outright, preferring the loss of a limb to having insects deliberately placed in their bodies. Elizabeth learned not to judge them. Everyone had their limits, their lines they wouldn't cross. She respected those boundaries even when it meant a soldier faced amputation that might have been prevented. The medical ethics of Elizabeth's initial decision remain complex. She treated Morrison without explicit permission from him or authorization from her superiors. In any other context, this would be considered unacceptable. But in the extreme circumstances of battlefield medicine, with a young man facing certain amputation and possible loss of life, the normal rules bent. Major Bradford's decision to support her after seeing the results was equally ethically complicated. He overlooked what should have been a court-martial offense because the outcome justified the breach of protocol. This set a precedent that allowed for innovation but also raised questions about proper procedures and patient consent. Elizabeth wrestled with these questions for the rest of her life. In interviews, she admitted that she had been terrified she might harm Morrison. She acknowledged that in peacetime, with proper resources and oversight, she would never have taken such a risk without authorization. But war medicine operated under different rules, and sometimes the choice was between a questionable action and certain catastrophe. The historical record shows that her judgment proved sound in most cases. Of the soldiers she treated with medicinal maggots, approximately 70% retained their limbs. This compared to a near 0% limb retention rate for soldiers with advanced gangrene using conventional treatment alone. The numbers spoke for themselves. But Elizabeth never forgot the ones who didn't respond to treatment, the soldier whose infection was too advanced, whose leg had to be amputated despite the maggots, the patient who developed a severe allergic reaction to substances in the maggot secretions. The young man whose psychological trauma from the treatment left him with nightmares long after his wound healed. These cases haunted her. They reminded her that even successful medical innovation came with costs. That saving most patients didn't erase the ones you couldn't save. That even when you did the right thing, it didn't always feel right. The war ended in 1945, but the impact of Elizabeth's work continued. Veterans who had received the treatment shared their experiences. Some wrote articles for veterans' magazines, others spoke at medical conferences. Gradually, the story of battlefield maggot therapy became part of the collective memory of World War II medicine. But as antibiotics became abundant and infection control improved, the technique faded from practice. A new generation of doctors trained entirely on antibiotics and modern antiseptics. The idea of using insects for medical treatment seemed as outdated as bloodletting or trepanation. For decades, medicinal maggots existed only in medical history books and the memories of aging veterans. The renaissance of maggot therapy in the late 20th century occurred independently of Elizabeth's wartime work. Researchers rediscovered the technique not through military archives, but through their own investigations into traditional healing methods. They were surprised to learn that what they thought was a novel approach had actually been used extensively just 50 years earlier. This pattern of forgetting and rediscovering is common in medicine. Knowledge gets lost as practices change and priorities shift. Techniques abandoned as primitive or outdated sometimes contain valuable principles that later generations must relearn. The medical establishment's collective memory can be surprisingly short. Today, medical historians study the use of maggot therapy during World War II as an example of battlefield innovation. Medical schools occasionally mentioned it in lectures on alternative treatments or medical history. But few people know the specific stories behind the general practice. Few know about Elizabeth Mason and the night she made a decision that would save hundreds of limbs. Her contribution wasn't the discovery of medicinal maggots. That knowledge dated back centuries, had been documented in medical literature, and had been used in previous wars. Her contribution was having the courage to act on that knowledge when everyone around her thought it was too disgusting, too primitive, too impossible to work in modern medicine. She proved that sometimes the best innovation is remembering what worked before. That solutions dismissed as outdated might simply be underutilized. That effective medicine doesn't always come in a clean package with a pleasant smell and easy administration. The soldiers who kept their limbs understood this. They didn't care that the treatment was revolting. They cared that it worked. They cared that they went home whole. They cared that they could walk, run, dance, and live normal lives instead of spending decades as amputees. Private James Morrison lived until 1995. He worked his family farm for over 50 years after the war. He married his sweetheart, had 5 children, and watched his grandchildren grow up. He played catch with his sons using the leg that should have been amputated. He walked his daughters down the aisle, using the leg that should have been sawed off in a field hospital in Tunisia. Every year on the anniversary of his treatment, he wrote a letter to Elizabeth Mason. He thanked her for her courage, her wisdom, her willingness to try the impossible. He updated her on his life, his family, the farm. He sent photographs showing him standing, walking, living. For Morrison, those maggots weren't revolting. They were miraculous. Elizabeth kept every letter. After she passed away, her family found them in a box in her closet, tied with a ribbon. Dozens of letters spanning 5 decades, from a farmer in Iowa to a nurse in Boston. A correspondence that documented not just one man's life, but the profound impact of medical innovation born from desperation. The lessons from Elizabeth Mason's experience extend beyond the specific techniques she employed. They speak to the nature of medical progress, the balance between protocol and innovation, and the courage required to challenge conventional thinking when lives are at stake. In modern medicine, we have robust systems for testing and approving new treatments. These systems exist for good reason: to protect patients from harm, to ensure treatments actually work, and to prevent the use of dangerous or ineffective methods. But these same systems can sometimes slow the adoption of beneficial treatments, especially unconventional ones that challenge established practices. Elizabeth's story illustrates the tension between safety and innovation. Her initial treatment of Morrison violated protocols designed to protect patients. Yet following those protocols would have resulted in the young man losing his leg. Sometimes the rules designed to prevent harm can inadvertently cause it by preventing beneficial action. This doesn't mean medical protocols should be abandoned. It means we must maintain space for clinical judgment, for innovation under extreme circumstances, and for the resurrection of old knowledge that modern medicine may have prematurely discarded. The return of medicinal maggot therapy to modern medicine validates Elizabeth's judgment. Contemporary research has confirmed everything she observed in that desert field hospital. The maggots do consume only dead tissue. They do produce antimicrobial substances. They do promote healing in ways that conventional treatments sometimes cannot match. Modern implementation differs from the crude methods used in World War II. Today's medical maggots are raised in sterile laboratories, ensuring they carry no harmful pathogens. They're applied using special containment systems that keep them precisely where they're needed. Treatment protocols are carefully controlled with clear guidelines for when to use them and how to monitor progress. But the fundamental principle remains the same. Sometimes nature provides solutions that human technology cannot match. The maggots perform a function that no drug, no surgical technique, no artificial system can replicate as effectively. They are living bioreactors, each one a tiny factory producing exactly what the wound needs to heal. Elizabeth Mason would be pleased to know that her desperate wartime measure has become an accepted medical treatment. She would be gratified that current patients benefit from something she helped prove effective. But she would also remind us that the maggots are just tools. The real story is about the human courage to use those tools when others say it's impossible. The field hospital in North Africa, where Elizabeth began her work, no longer exists. The tents were struck, the equipment packed away, the temporary structures dismantled when the campaign ended. The desert reclaimed the space, erasing the physical evidence that a medical revolution occurred there. But the impact remains, in medical journals and textbooks, in the stories veterans told their families, in the lives of men who kept their limbs, and the children and grandchildren who exist because those men came home whole. In the modern patients who receive medicinal maggot therapy without knowing they're benefiting from a treatment proven effective by a desperate nurse in a desert war. This is how medical progress actually happens. Not always in gleaming research laboratories with controlled conditions and peer review. Sometimes in field hospitals under enemy fire, in situations of desperate need, by people willing to try the impossible, because the possible has already failed. Elizabeth Mason spent 1 year in North Africa. She spent 45 years working in hospitals in Boston. But that 1 year, those few months of using maggots to fight gangrene, became the defining achievement of her career. Not because it was the most time she invested, or the most patients she treated, but because it was the moment she changed what medicine thought was possible. She proved that a nurse with a medical journal article and the courage to act could save hundreds of lives. She proved that old knowledge still has value in the age of modern medicine. She proved that sometimes the most impossible solution is actually the most effective one, if you're brave enough to try it. The scars on Private Morrison's leg tell a story. The story of shrapnel and infection, yes, but also the story of innovation and courage. They tell the story of a nurse who refused to accept that amputation was inevitable. They tell the story of a young soldier who trusted that nurse enough to let her try something revolting, They tell the story of tiny insects performing a medical miracle that everyone said was impossible. Those scars represent every step Morrison took for the rest of his life, every moment he stood on his own 2 feet, every time he walked without crutches, without a prosthetic, without the permanent disability that gangrene should have given him. Those scars are a testament to what's possible when we're willing to look past our revulsion to see what actually works. Elizabeth Mason died knowing that her work had mattered. She died knowing that dozens of men lived fuller lives because she had been willing to do something disgusting. She died knowing that sometimes, just sometimes, one person with courage and conviction can change the world in small but profound ways. The story of medicinal maggots in World War II is ultimately a story about human ingenuity in the face of suffering, about the willingness to try unconventional solutions when conventional methods fail, about the courage to act when others say it's impossible. It's a story that reminds us that medical progress doesn't always move in a straight line forward. Sometimes we need to look backward to find forgotten solutions. Sometimes we need to resurrect old knowledge that modern medicine dismissed too quickly. Sometimes the most advanced treatment is to remember what worked before. And it's a story that celebrates the nurses, the medical professionals who work closest to patients and often see things that others miss, who notice patterns and make connections, who have the courage to advocate for treatments they believe will help, even when those treatments challenge conventional thinking. Elizabeth Mason would probably be embarrassed by being called a hero. She would insist she just did her job. But the men whose limbs she saved knew better. They knew that on a night in the North African desert, one nurse decided to try the impossible. And in trying, she proved it was possible after all.